Hello, I'm John Eagles, a retired psychiatrist who has been involved in developing the Temple V program. This short webinar will discuss some of the health benefits of physical activity. In another separate webinar, I shall go into the role of exercise in both weight loss and weight loss maintenance. So this presentation is almost solely about the other good things that physical activity can do for us. Western industrialised populations have become a good bit more sedentary over recent decades, but we did evolve hundreds of years ago to be active animals, so it is not surprising that moving around is good for us. There is a lot of evidence that physical activity is very helpful in both treating and in preventing illness, and I shall kick off with the conditions that exercise can help to treat. This list could have been much longer, but these are the areas in which the evidence is strongest. In type 2 diabetes, an increasingly common condition, the role of exercise can actually be curative. As an ex-psychiatrist, the emerging evidence that exercise can be as potent a treatment for depression as antidepressant medications is especially interesting to me. With hypertension, again, physical activity can be as helpful as medication in lowering your blood pressure. Improvement with chronic pain is interesting, perhaps because exercise can increase your endorphins, otherwise known as nature's natural painkillers. And if you experience a heart attack or develop a serious lung infection, you will recover more quickly if you are physically active. And what about illness prevention? There is suggestive evidence that exercise has a role to play in preventing a lot of different types of cancer, but the evidence is irrefutable for both bowel and breast cancers. People who exercise are a lot less likely to suffer a heart attack or a stroke, possibly due to the positive effect on blood pressure and cholesterol levels, but I shall come back to these factors later. Diabetes is much less likely to develop in physically active people. Exercise protects you against weak bones and arthritis. There is developing evidence that active people are less likely to develop Alzheimer's disease, and more recently, there have been suggestions that exercise might buffer you against Parkinson's disease as well. Active people are also less likely to become depressed. Another way to look at the data is to consider life expectancy. The effect of physical activity is quite striking, and a recent paper calculated that the risk of early death was reduced by as much as 20 to 35%. As this slide indicates, the likelihood of dying from a heart attack or stroke is hugely reduced, and a woman's risk of cancer is reduced by around a third. So, what might underlie the benefits from exercise? Why is it so good for us? It would be fair to say that there are lots of theories and no definitely proven facts. Perhaps, obviously, if it helps people to stay slim, which will be the topic of another webinar, then that in itself will have major health benefits. Being physically active makes you feel better generally, improves your self-esteem and your mood, which will also have a knock-on effect to your physical health. Exercise helps you to sleep better, and good sleep also confers health benefits. There are other more direct benefits according to the medical scientists, and you'll see some of these on this slide. So exercise reduces insulin resistance, and this helps to control blood sugar levels. It helps to balance your hormones, speeds up the clearance of substances that might contribute to an increased risk of cancer, and will also help in this way by enhancing cell repair. So, lots of benefits. But how much exercise do we actually need? Here are the World Health Organization targets, which are very similar to those produced by the UK government. As you can see, these advocate a lot of exercise and seem to suggest that these are the minimum targets required to get any health benefits. The problem here is that the recommendations are not based on good evidence. These recommendations are based on what people say they do, and it has actually been proven that people exaggerate the amount of exercise they report, just as we underestimate the amount of alcohol that we drink. Based on what people say they drink, accounts for only half of the alcohol sales in the UK, which makes you wonder what happens to all the rest. Although such high targets may be admirable, if you advocate targets that the average person thinks are unachievable, this can be very demotivating, and this can actually prevent someone from even trying. If someone told you that the only way to get fit was to live on cabbage soup and run 3 marathons a week, you wouldn't even start to follow that advice because it would not be achievable. Luckily, there is evidence that a whole lot less exercise than government guidelines advise can be thoroughly good for you. A big study in The Lancet found that people who exercised for an average of less than 15 minutes per day lived 3 years longer than an inactive group. Another study found additional health benefits from doing some muscle strengthening exercises just twice a week. And another study in Sweden found that fairly minimal exercise, such as gardening, housework chores and walking, markedly reduced people's risk of early death. Even standing up seems to be good for us. The so-called SMART study got people in sedentary jobs to reduce their sitting time, to stand up and move around a wee bit over a period of a year. The standing group, compared to workmates who continued to sit down as before, were less tired, less anxious, enjoyed their jobs more, and reported a better quality of life. Other similar studies suggest that if standing is good for you, then moving around is even better. Some people think that the findings reflect that sitting is bad for us, and that there is an association between bad health and how long per day someone spends sitting watching TV. So, to summarise this webinar, we humans have evolved as an active species, but we have become more sedentary, and inactivity is just not good for our health. I have listed the conditions in which exercise has been specifically shown to be beneficial in the treatment and/or the prevention of these illnesses. Active people live longer, healthier lives. Published government targets recommend a lot of exercise, and while more is even better, low levels of physical activity are also thoroughly beneficial. So anything active that you can do, as opposed to sitting around, is likely to contribute to you living a healthier, happier, and a longer life. Thank you.